Today I would like to talk something about the non-operative treatment of osteoarthritis of the knee. Now, with the increasing popularity of total knee replacement surgery, most people have realized that this is the gold standard for treatment of the end stage of this disease. But even today, the mainstay of the great number of osteoarthritic patients is still non-operative. And a good trial of non-operative treatment gives excellent results and is actually quite mandatory before anyone is taken up or advised surgery. Now, the beauty of this whole thing is that a lot of this treatment actually can be done by the patient himself or herself with help and advice from his or her orthopedic surgeon. So, if we briefly look at what are the various modalities which constitute non-operative treatment for knee arthritis or knee osteoarthritis, then exercises form a very important part. So, what exercises to do? Evidence suggests that aerobics are beneficial and muscle strengthening exercises also help a lot, particularly the quadriceps group of muscles. So, exercises aimed at increasing quadriceps muscle strength have been shown to be beneficial, and the evidence here is actually very strong. What is perhaps not so effective or not so beneficial is uh, weight training. So, strenuous weightlifting, etc., should be avoided. But aerobics and muscle strengthening have been, beyond doubt, have been shown to have very strong evidence for benefit in osteoarthritis. The other physical modalities which are of use is local warmth. So, just before the exercises, if you use warmth, then this also uh, helps in alleviating the pain of osteoarthritis. Lifestyle management is a very important aspect, and this includes, it has many aspects to it. The first is that weight reduction. One should try and shed weight as far as possible and bring it to what is recommended level. This goes a long way. Again, very strong evidence to suggest that weight control can decrease pain of arthritis. The other, of course, is one should avoid using low seats or squatting on the ground. That should be avoided. It is good to use a comfortable chair. A hard chair is better than a soft sofa. And so, this sort of lifestyle adjustment, I think, is very important. Climbing stairs is not contraindicated, but it should be, I think, limited to what is essential, and unnecessary climbing of stairs, I think, should be discouraged. Or otherwise, it's not an absolute contraindication. The other aspect, or one of the other modalities, is splintage. Now, it has been shown the one um, splinting which has again very good evidence of effectivity is patellar taping. So, patellar taping has been shown to be effective. Varus stress and valgus stress splints are cumbersome and really have no proven benefit, and I think perhaps do not have much of a role. Heavy splints which tend to offload the quadriceps are again not recommended because these can very quickly lead to quadriceps wasting and knee stiffness. Range of motion exercises, of course, is one thing I didn't mention, but range of motion exercises are again very useful. Uh, the other part of exercise is walking. I think impact activities such as jogging is not to be recommended, but swimming and walking are other activities which are greatly beneficial in managing osteoarthritis. So, using all these modalities, I think a huge number of cases can be satisfactorily managed uh, by the surgeon and the patient himself. Even in fact, there are interesting papers which show that just telephonic conversation with the treating physician helps to alleviate knee pain, because as we all know that any kind of pain has a very significant psychological component. So frequent contact between the patient and physician is another important way to reduce pain. So I think if we can practice all these things, uh, there are obvious benefits of this non-operative treatment. And it is only when these modalities have all been exhausted and the patient is severely deformed or is not able to undergo activities of daily living, should we then offer the wonderful surgery of total knee replacement to these patients. And that, of course, in the properly chosen patients, gives absolutely spectacular results. Thank you.